Hey guys, it's been a minute hopping on to talk about my new subscription group. I've gotten a lot of questions about that, so thought I would take some time to hop on and discuss it with y'all. Hubby's got dinner covered for tonight, so he's working on that. I'm doing a quick live before we all get together for dinner, so if you have questions about the subscription group, of course, let me know what those are. Meanwhile, I will talk about what is included in the group. So first, let me just talk about what the heck the group is. So the BBT skills group is for people with BPD, borderline personality disorder, who are having challenges with emotional regulation, tolerating distress or change in their lives, struggling with maybe interacting with other people, those interpersonal skills, and different concepts like that. DBT is the basis for the group, dialectical behavior therapy, and that operates on a continuum of acceptance versus change. So Linehan, Dr. Marsha Linehan is the creator. She created DBT after spending over 2 years in the hospital herself and being very dismayed with what they were doing, didn't feel it was helpful. So she wrote her own model. And now this method is the cardinal treatment for BPD. It's not the only way, it's just the way that I've had the most success with. So it's based on 4 different modules, and it's all about learning to control your reactivity, changing the way you process information, changing the way things occur to you. Because again, BPD is a personality disorder, but it's also an information processing disorder. So information comes in through your 5 senses. You perceive it. That's your perception. That information, based on your life experiences, those things serve as a filter. That perception gets filtered. It becomes your perspective. And your perspective is where your thoughts are. The thoughts come out of your perspective, your take on the situation. So your thoughts then generate feelings, which then generate behavior. So we want to intervene at a thought level. We want to intervene as early in that chain as possible. Now we do some stuff with DBT to address trauma and kind of try to change the filters that you see information through. So that's really important when you work with me as a deep dive into family of origin to understand why you think and behave the way that you do. It's very difficult to change your personal narrative if you don't even understand how the hell it was written in the first place. So that's an important part. But if you're doing the skills group, it's not a therapy group. It's just a monthly subscription group where we're learning about skills for coping with BPD. I'm going to read to you guys some of the things that we're doing over in that group. And right now the group is $19.99 a month, and your first 7 days are free. So if you're not sure, $20, not sure if you want to invest that, not sure if you want to spend that, hop on in. Do it for 7 days, give it a trial, make sure it's worth your time and money, and then set a reminder in your phone to go in and cancel that subscription before you get billed after the first week. No hard feelings. I'm not for everybody. Not everybody likes my approach. I get that, and that is okay. So check it out for 7 days free. It's the BPD skills group. It's about building a life worth living, which is an important concept in DBT and so BPD recovery. We want to build a life that's worth living, that we enjoy, that we don't need a vacation from. And we want to be able to step out of our heads and our habits and our ways and our perspectives and step into that life that we love. So the DBT group, the group members are getting special subscription-only videos on different coping skills for how to deal with the different things that come up for people with BPD. And then they're also getting lives. They'll be getting individual lives just for that small group where more intensive questions can be asked and there can be more of a deep dive into some of these concepts that we're working on. So right now, I'm getting ready to, or I've either done or getting ready to post a video on some of these topics. So one of the things that I recorded today is de-escalation techniques. So, and that's twofold. So de-escalation techniques, if you're in, or if you have BPD, how to sort of down-regulate your own nervous system a little and then work with people in an intense situation. That one's also a really good video for people you love, people who love you, care about you, are in relationship with you. So they can watch that video and they can learn how to help you de-escalate or calm down when your emotions get intense, because overcoming BPD is all about doing emotion regulation, learning to regulate your emotions and get rid of that black and white thinking. Hey, Cody, thanks for hopping in. So the group is talking about de-escalation techniques. And then I'm also doing a video on all of my currently 6 strategies for minding the gap. So these are strategies about how to de-escalate yourself. So within you, how can you mind that gap so that between thought and feeling behavior so that you can respond and not react. We're all about trying to mitigate vulnerabilities and reactions. So one of the videos is about how to de-escalate situations and, with others. The other video is about minding the gap and the 6 strategies that I use with people for doing de-escalating themselves, basically. We're also going to be looking at BPD symptoms as coping mechanisms. They are coping mechanisms. They're not healthy coping skills, but they are coping skills nonetheless. And so we're looking at how those serve as coping mechanisms, but also then looking at DBT and how that helps with trauma-related BPD symptoms. Not everyone who has BPD has been through trauma, but the preponderance of people, like 70 to 80%, the majority of people who have BPD have been through some sort of trauma. And a lot of the research talks about being born with a certain emotional vulnerability. So if these people are born with an emotional vulnerability and then they're placed in an invalidating or neglectful or abusive environment, that's adding insult to injury. So then what happens, it's all like compounded. It's like everything's piled on top of itself. So we're learning how to regulate, self-regulate, get the emotional regulation under control, and then respond in better ways. So the DBT for trauma-related BPD symptoms, de-escalation techniques. We're going to be looking at non-confrontational communication skills. So DBT is all about getting your needs met, being mindful of your own needs. You get to have those just like everybody does. And how can you get those needs met? Through your communication. So non-confrontational communication skills, that's an upcoming video in the subscription group. Again, if you're just joining a subscription group, $19.99 a month, your first 7 days are on me. I want you to try it before you buy it. Make sure it works for you. Make sure it's worth your time. Take a look at some of the videos that are already in the library. See if that's stuff that you're interested in. Or join the group for 7 days. Set a reminder in your phone to turn it off or keep going after the 7 days. Totally up to you. No hard feelings. I want it to be worth it for you. And some people may already have a lot of the skills, and so then the group isn't worth it for them. But $19.99, first 7 days are on me. So check that out now. Just tap that subscription link and you can get more information. We're going to be talking about how water seeks its own levels. So this idea that the healthier we are, the healthier the people we attract into our world. And what that looks like and how to obviously get healthy so that we can draw in healthier people. We're going to be talking about you feel what you think. So thoughts, feelings, behavior. You guys have heard me talk about this over and over. But thoughts, feelings, behavior. And so we want to intervene at that thought level. We've got some de-escalation techniques, all of my minding the gap strategies. We're going to figure out how to, before you get to that feeling point, we want to figure out how to intervene at the thought level. So you feel what you think. We're going to be looking at trauma in BPD and different strategies for coping with that, different therapies that are available so that you're informed and you know what's out there. We're going to be doing work on triggers, so understanding and identifying triggers, and then how to regulate those triggers, how to control your response. So again, the primary issue in BPD is emotional dysregulation. And so it's really important to learn how to regulate those emotions. And lots of things go into this. So people with BPD tend to have an emotional vulnerability. They tend to personalize things more often. They tend to have black and white or catastrophic or absolutist or binary thinking, whatever you want to call it. There's the opposite of minimization. So information comes in and it doesn't get minimized, but it gets maximized, and that generates reactivity. We're looking at how to do response versus react. We're looking at some healthy outlets for people with BPD. A big one that we're going to be spending time on is how to create boundaries. So looking at what the heck is a boundary, first of all, and then how to create appropriate boundaries, how to set those boundaries. And then sometimes the hardest part is following through. So you can set the boundaries, but then people struggle with like maintaining the boundaries and maintaining that perimeter that they establish. It's important to make sure that you not just set them, but you have to maintain them, which is kind of a whole separate thing. So the healthy outlets for people with BPD, how to create boundaries, looking at some of the things that are part of my subscription group, $19.99 per month. First 7 days are on me. Go check it out. Why therapy doesn't work for BPD and what to do instead. A lot of that has to do with the relationship. So we're going to be talking about what is going on there. I've got some stuff coming out. You guys may have seen the 4 sectors of BPD psychopathology. That's been a really popular video this week. I talked about the 3 roles of emotions. That's another one that's on my general feed. Why do people self-harm? That's coming up. So we're going to be looking at the different reasons that people tend to self-harm. And then, of course, in the group, we'll be dealing with strategies for coping with that, and how to create mindfulness around that and find different strategies instead of self-harming. So self-harm, in case you're not aware, it can be any number of things. It can be cutting yourself, burning yourself, biting, pinching, even kicking yourself, banging your head against the wall. That's another one. So we're going to be talking about strategies to deal with that. I'm going to look at some of the comments that you guys are chiming in. One thing I've realized is no such thing as balance. You know, Katerina, it depends on what you're talking about, right? Overall, there should be a balance in your life in a number of different ways. But depending on what season you're in, there's not necessarily balance. There's not necessarily maybe like a work-life balance. So if you're starting a business or something, like you're putting a bunch of upfront energy, there's not necessarily that balance. But internal balance, that's something that you have to create. And there's self-care that's involved in that and a number of other things. So I do hope that you can find the balance at the right season. Okay. Is there anything wrong with burning myself if I just clean the wound? Because is it not perfectly safe? It's not perfectly safe. So even if you clean the wound, staph bacteria are all around us, constantly in our environment. So if you have that raw flesh exposed, or even if you put a bandage on it, I mean, staph bacteria are all over your body at any given time. So at any moment, there's bacteria that can get into that wound and cause all sorts of problems. So anything that you're doing to self-mutilate your body, it's a maladaptive coping skill. We got to figure out what's driving that for you and teach you some different skills so that you can do other things besides that. Katerina, it has to do with relationships. So that's a good point. In relationships, you know, sometimes there's a balance where it's 50-50. Sometimes depending on different seasons that people are going through, maybe it's 70-30. Maybe one spouse or one partner has to do a lot more emotionally or financially, spiritually, whatever it is. So balance can definitely vary in relationships. Yes, that's a good point. Keep it covered with gauze and antibiotics. It's still not entirely safe. Anything that is an injury, an opening in the skin, creates the opportunity. It's a vulnerability, so it creates the opportunity for something to get in, and your immune system has to, wage an attack against that. At the end of the day, again, you're harming yourself. So we want to figure out some coping skills that you can use that don't involve harming yourself. Another strategy that some people use, some people don't necessarily care about this, but other people they tell themselves about the scarring that they might encounter from self-injury, and then they don't want like their future children one day to ask about that, or they don't want a potential relationship partner to ask about that. Some people really don't care, but that's one strategy that a lot of people have used. Like they don't want to have to answer for that later on. But it's any form of self-harm. There's a reason that you're doing it, and you're doing it as a self-medication. It's a coping skill, like I said. So we want to figure out a different way for you to medicate the emotional wounds and the psychological challenges that you're dealing with. Okay. That's any type of relationships, family, work, etc. Yeah, there may be an imbalance in those relationships at times. I think we're saying similar things, but what I want to emphasize is that it is important to take care of yourself. If you don't take care of you, nobody's going to do it for you. So you want to make sure that you're engaging in self-care. That is really important. And creating balance between like work, and actually living your life and enjoying it. So it does vary, to your point, it does vary in relationships. Like I said, different seasons require different investment from partners in the relationship. Yes, okay. All right. Other questions about the group? Or anything that you want to suggest for the group if you're thinking about joining it, or just, availing yourself of the free trial. Is there anything that you'd like to see while you're in there? Right now, $19.99 a month, first 7 days are on me. So go check it out. You can see the library of stuff that's already there, and then I'm just adding to that every day. Thank you guys for the gifts. I appreciate it. Tips. I have literally every day, not get some tips. I've literally been rolling by every day, not trying to change up my day. Well, maybe you can say more about that. But the sometimes there's comfort in that predictability. So habits and routines and that structure, it gives predictability, which is control, and that's an antidote for anxiety. So sometimes those kinds of things can be really helpful and useful. Other times, to your point now, I think maybe, you're looking at something else. And if you're bored with life, if you feel like you're just sort of surviving and not thriving, then I think it's really important to figure out ways where you can insert things to shake it up. So doing something different. Now, this can be literally as simple as taking a different route to work or the grocery store. Like where I live here, you can go on the main freeway or you can take the back roads. I'm sure that's true for a lot of people in situations, but you have a couple of options. So literally just changing that up can make you feel like you're doing something different. That's a really small, easy to do thing. Outside of that, you want to look for opportunities to insert joy. So experiences that bring you joy or delight. So I do the bare minimum. So sometimes that's a season that we're in and we're just trying to function and keep our head above water, pay the bills, get by, whatever. So I think it's important too, like, how do you define that, right? Like some people, their bare minimum is literally the bare minimum. Like, this is what I do to keep a roof over my head, and I don't do anything else. I don't socialize. I don't talk to anybody else. I don't have any hobbies, whatever. Other people, what they think is the bare minimum, they're actually way overstating the situation and they're doing a whole lot more. So if you feel like you're just kind of going through the motions, then I think it's important to make a concerted effort to find ways to sort of shake that up. So if that's, like I said, taking a different route to work, making a pledge to like call a friend or text a friend once a week, do something different, do something for yourself every week. One of my favorite things to do is to get outside, and get vitamin D. So D stands for depression is what I always say. So get that vitamin D to generate energy and get the vitamins from the sun. So I see. I don't even like going different routes. I always want to go the same route. Well, you may just be drawn to that predictability in this season of your life, and that can be okay. But you can still find ways to insert like different joyful experiences or just do something different. I mean, again, another small example, if you're watching, Netflix is my guilty pleasure. So if you're watching a series on Netflix and you've been watching it for a while, some of them go on forever, right? Pause it, do something different. Watch a different series, watch a comedy, watch a comedian, watch, something totally different, a different genre than you would normally watch entirely. Just finding ways to shake things up. I don't want you to overthink it and think you have to do these big dramatic things to really change your life, right? Like just doing little things here and there can be a great starting point. So staying persistent with it and, just giving yourself different options, shaking things up for yourself, whatever that looks like for you. It looks different for different people. Would you think that someone with BPD could be self-employed? You betcha. I have multiple patients with BPD who are self-employed. One of them is actually in mental health. She owns her own practice now. So that's an evolution in her life. She was working for people for many years, and now she's working on a private practice. It's incredibly rewarding to watch. But I've seen people with BPD have all different sorts of businesses of their own. So absolutely yes. All right. AI is giving me some tips. I haven't seen that before. That's awesome. Hi. All right. AI says relationships discussed. Share tips. Okay, we can do that. I'm just making sure I got all the comments. What would you say is the biggest flex with people who are BPD? Oh my gosh, I've never been asked that question and I love it. So the biggest flex with people who are BPD. So I'm assuming you mean like if someone has BPD, what's the biggest flex that they can work toward or make or do, or a way that they can behave. If that's not what you're saying, let me know. But meanwhile, I'm going to respond to it from that perspective. So the biggest flex for people with BPD, I love this question so much, is that of learning how to respond versus react, because that includes a whole lot of stuff. Right? So it's really about mitigating vulnerabilities so that you can respond versus react. This is where minding the gap strategies come in, et cetera, et cetera. So learning how to not let other people be in control of your emotions. I mean, I think that's the biggest flex for humanity, honestly. But I think that's huge. Like just learning, like never let them see you sweat kind of thing. Like you're not going to get to me. I have learned how to regulate my emotions. Doesn't mean you can't feel intense emotions, right? We all get pissed off now and then, right? But with anger, for example, like once you learn what's driving your anger, you learn that anger is a secondary emotion, that there's always something else primary driving it, like sadness, fear, anxiety, worry, guilt, shame, embarrassment, the list goes on. But once you learn what's driving the anger and you can tackle those situations and then mitigate those feelings, your responses totally change. Like once you can make it so that people don't get your goat, like it's huge. It's huge. So biggest flex, I love that question. Thank you so much for that. Is regulating your emotions and responding versus reacting. Everything goes into that: black and white thinking, personalization, catastrophization, you name it, it's all in there. So just not letting people get to you, really. I mean, that's really what it comes down to. Thank you for that question, Dark Angel. Okay, saying, yes, okay, that was the right. Clock it. I love it, Katerina. Hey, Laurie, how are you? Thanks for joining. We're just talking about my new subscription group. So for those of you just joining, $19.99 a month. First 7 days are on me. Go check it out. Set a reminder in your phone after 7 days. Do I want to stay? Do I want to go? No hard feelings. But your first 7 days are free. I want it to be worth it. Like not everybody needs the training that I'm providing, and I realize that. And also I'm not for everybody. I realize that too. and that's okay. So just check it out and see what you think. First 7 days are free, no obligation. Okay, I'm just making sure I got these. All right, I do have BPD. I have done the work in 7 years. Awesome. Awesome. Maybe you can share then like what you think your biggest flex is as someone speaking with BPD. Like, what do you think your biggest accomplishment has been, or like what do you feel the most proud of? And anybody can chime in, not just Dark Angel who's asking us the question, but yeah, anybody can chime in. Like your biggest flex as someone with BPD who's walking that road of recovery. Like, what are you learning? What have you done? What's been the most helpful? I was just having a convo with someone, you know, Dr. B says anger is a secondary emotion. Cody, you're my girl. Absolutely. It's always secondary, never primary. Okay. Okay, my anger took 2 years of work. Listen, that's not the longest I've heard. So good on you though for doing the work, right? Like stick with it. And life can be different. Your life, if you have BPD, your life doesn't have to be this way. That's so upsetting and distressing, and you're always in your feelings, and anger is driving you, and like it doesn't have to be that way. You're like my reminder I'm doing the right thing. Oh, Katerina, that's awesome. I love hearing that. Or taking the right steps. Yes, I love it. I love it when I can just be that sort of subtle reminder for people like, hey, just keep going, keep it moving. I work for myself. I'm also a mother who is not just navigating myself, but my children as well. God bless you. That's a lot. You work for yourself. You have kids. You are running your own business. Like, it's a lot. So you're a testament to the fact that someone with BPD can have a business. So you answered your own question. But I love it. Thank you guys for chiming in with your comments and questions. I love hearing from you. Again, we're talking about the different things going on in my BPD skills subscription group. Again, want to emphasize, not a therapy group, but we are going to be doing some DBT for trauma. We're looking at BPD symptoms as coping mechanisms and what to do instead. I just recorded a video today about de-escalation techniques, 2 of them actually, so de-escalating situations and de-escalating other people. So that video would be good for people who care about you, and they can learn those skills to help de-escalate situations if they see that you're starting to get intense, and if you give them permission to hold you accountable in that way with a code word or different things we're going to be talking about. Then there's also de-escalating yourself. So I did a video with 6 minding the gap strategies for moving from reaction to response. So that's going to be live in the group soon. We're going to be talking about the idea that you feel what you think. We're going to be talking about trauma. Let's see. Biggest flex has to be noticing bad repetition and cutting it or someone off. Amen. So setting boundaries, that's a huge flex. Absolutely. And I feel like that, you know, like, I think the biggest flex is that emotional regulation. And so that kind of goes with it, right? Like once you learn to identify your emotions, you can find better ways to deal with them, including setting boundaries with people who get you wrapped around the axle, so to speak. So absolutely nothing wrong with that. We are talking about boundaries in the group upcoming. So how to create those boundaries, the importance of maintaining them, because again, creating them is one thing, maintaining them is actually something separate. It's kind of like weight loss. Like losing the weight is one thing, but keeping it off and maintaining it is another issue. That's why a lot of the crash diets and all these different medications and stuff don't work, because once you stop doing that, then the weight comes back. So it's kind of like that. It has to be repetitive. You have to be consistent and persistent. But yes, boundaries, Katerina, absolutely. I'm glad you're learning that. I believe that it's not a bad thing to have. If you can learn to control, you can succeed. Amen to that. I think that people with BPD are some of my favorite people, because it's like you just know where you stand. Like they're going to tell you, right? Like I love working with them in therapy. I have some of them in my life. I don't diagnose them. They're not my patients, but I've been doing this for over 20 years, so I can kind of sense it. But they tend to be a lot of my favorite people because they're just very direct. They're very honest. What you see is what you get. They're not trying to do a bunch of small talk. Like they want to get into, like, let's talk about real things. Like, so I could see that. Absolutely. It's not a bad thing to have, right? Like nothing is a bad thing to have as long as you learn to control it. You first have awareness of it and then learn to control it. To your point, Dark Angel, yes. New ones or old ones arise, so it is a repetitive process. The boundary setting, the challenges keep arising. Yeah, I mean, I've got people I've been seeing in therapy for some of them for years because of a number of different traumas that they've gone through that we are unpacking and so forth. But most of my patients sort of evolve into using like a medical model. So they come in for a while when something's broken, right? So like a broken arm, you go to the doctor, right? I hope, and get it fixed. So there's, we mend the broken arm. We get them a cast, emotionally speaking, we mend that. And then maybe they stick around for a while and learn some more coping skills because in the process of dealing with that issue, all this other, childhood trauma and a bunch of other things come up. So they stick around for a while and we work on that. Then they're doing well. Like the patient I spoke about the other day, she is doing great. And so she just comes in periodically, literally like maybe a few times a year at this point, and just kind of gets a booster session, if you will, because something has hit the fan. So like she had a work issue recently. So she came in and she's like, pardon my expression, she's like, this bitch, right? Like she is like ready to rumble with this chick. And I'm like, okay, remember who you are, remember the work that you've done, et cetera, et cetera. And so, we give her a little booster session. She goes out, she tries the skills, she comes back, Jen, this worked, this didn't work. We modify, we tweak, we whatever, and then she keeps rolling. So it becomes a medical model, like you go to the doctor when something's broken or if you're sick, right? So we use the same thing. I use the same thing in mental health. Reading people in rooms is one as well. That's a flex, yeah. That one's challenging, right? Because you may be reading people the wrong way. But learning to read them and not exaggerate what you're getting or not take it personally, that's huge, huge. So yes, learning to accurately read people in situations for sure. Daughter has BPD. I'm trying to find support and advice for myself as a parent. Well, Crystal, God bless you. Thank you for hopping on. I do have a group I just started. She has her therapy, but I need help to help her. Yes. Definitely you can get support. So I work with people virtually in most states of the United States. If you're interested in that, you can reach out to me and I can give you all the information about it. I also have a BPD skills subscription group that I just started, $19.99 a month. First 7 days are free. I'm going to be posting about de-escalation techniques in that group. And so those techniques are useful for people with BPD, but they're also useful for people who support people with BPD. And it gives you strategies for how to de-escalate them and help them down-regulate their central nervous system. So if I can be helpful one way or another, please let me know. And then if you go on my website, it's under construction right now, so don't judge the status of it, but it's drbellingrodt.com, all spelled out, doctor spelled out. It's linked in my bio, but if you go on there and go into the resources tab, there's all kinds of books. There's a whole section on BPD with some of the books that I recommend that I think could be helpful. So Godspeed, Crystal. I hope that goes well. I think it's great that you're being supportive. A lot of people are like, oh, you need therapy? That's on you, right? Like it's a family systems issue. So I appreciate that you're doing that. My boyfriend loves watching my moods change on my face and with my body language within seconds. I don't know exactly what that means by loves, or like if he loves it so much that he's trying to get it to happen and he's antagonizing you, obviously then we have a problem. But I mean, to your point, yes, you can. I mean, I've watched people literally totally change in front of my eyes. Like I remember one situation in particular, the gal was talking and we were rolling along. We were reviewing like what was going on in her week, et cetera, et cetera. And then I said something that referenced another patient, obviously not their name, but just like, something like, you've got this. I just had a patient deal with this and, she overcame it. Like, you can do it. Whatever the context was that I referenced another patient, and it just washed over. Like she suddenly became really sad. So when I see that happen, of course, I don't let it be. So we talked about it. I was like, okay, what just happened for you? Like, I literally saw you change your demeanor. So we unpacked that. It was some jealousy that she was dealing with. And cognitively, she knew, like, I know I'm not your only patient. Good grief, I can't, pay all your bills for you. But it was a very emotional thing for her. So we unpacked that and she has done so much better since then. This was many, many years ago. So hopefully he's not antagonizing you, Dark Angel, and like trying to make that happen. But yeah, for some people, they wear their heart on their sleeve, and it is very evident. I know I'm shaking my phone every time I do this. I'm sorry, that annoys me. Okay. Unstable personality, BPD. Is it true that BPD causes binge eating? No, I wouldn't say it's a causal relationship. A lot of times they're comorbid, so they coexist. Eating disorders this is a whole other thing. But eating disorders are anxiety disorders by nature. They are ways to control things in your life, because the one thing that we can control in life is what goes in and out of our bodies. And so I think that they're often comorbid. They often coexist. Binge eating could be like an impulsive behavior. Of course, BPD has a lot of impulsivity, so it can be kind of a reckless behavior that falls under that. But there are plenty of people who have binge eating disorder who do not have BPD, and plenty of people who have BPD who do not have binge eating disorder. So I wouldn't say it's necessarily causal, but they can be correlated. So cause and correlation, to similar but different things. Hopefully that answers your question. If not, chime in with another one. Oops, skipping. Currently in a depression, any advice? I will come right back to that. Daughter does that, gets quite jealous, very attached to last therapist, hates the new one. There's maybe some splitting going on where she loved this one so much she can't love another one, so she has to hate this one. Or maybe the therapist just sucks. Like, my gosh, there are so many therapists in my industry who suck. In any industry, right? Like podiatrists, there are some who are wonderful and some who suck. Mechanics, some are wonderful, some suck. So it's anywhere, but hopefully she can develop some sort of a reasonable attachment and rapport with that new therapist. So she may need to just give it some time, or if it's just egregious and the person just really sucks, then you've got to keep searching. I'm going to come back to the depression thing. I just want to wrap up this talk. Therapists talk too much about... Hold on. I'm sorry, I'm trying to get back. Therapists talk too much about other family members. It depends on the situation. I mean, it's a whole family systems issue. So maybe it's just the approach. Again, maybe your daughter's splitting. It's hard to say. One of our biggest issues come when it's another person's action or behavior. Okay, I'm going to come back to that, Katarina. Lori, I'll come back to yours too. But I want to go respond to this person who says, I'm currently in depression. Any advice? I'm sorry to hear that. That's a really tough place to be. I've actually done a lot of writing about depression. So I talk about it from a disputing negative thoughts angle. So I've posted videos. I just did a video on YouTube recently. I think I maybe posted it on TikTok too, but anyway, instantly overcome negative thoughts. I give 4 strategies for overcoming negative thoughts. So when that stinking thinking gets in there that contributes to your low mood, you got to find those strategies to dispute it. I have online training built around that, so it takes that and expands on it a great deal. I also have depression antidotes. I believe that's a YouTube video. My YouTube is at Shrink Think with Dr. Jen, just like TikTok. So there's a depression antidotes video. There's a video on the top 10 tips for improving your mental health. So those are some resources that you might like to see, Kay. If you want more help, then certainly reach out to me and I can direct you more on that. But a lot of overcoming depression is taking care of yourself. Again, if you don't do it, no one's going to do it for you. So just doing little things, whatever you can muster the energy for each day, doing little things to slowly turn the tide on your mood. Anything you can do healthy that releases endorphins, those natural, free, legal, happy chemicals in the brain, that's going to be helpful. 20 to 30 minutes of physical exercise at a reasonable intensity. You don't have to sprint the whole time or anything like that, but 20 to 30 minutes of reasonable intensity physical exercise, those endorphins are popping off. So if you can just start somewhere. That's what I always say. Walk around the block. Just start with that. Walk up and down the sidewalk. Walk out your door to the end of your driveway and back. Just start somewhere and then work up to that 20, 30 minutes. But those resources could be helpful for you. Let me know if you need more on that. is one of our biggest issues come when it's another person's action or behavior? That's a loaded question, Katerina, meaning there's a lot that we could unpack there, but it's based on your perception, which generates your perspective, thoughts, feelings, behavior, that whole chain that I talked about at the top of the live. It's another person's action or behavior. We, in human interactions, one of the things that we tend to do that's not helpful for us is personalize things. And people with BPD are even worse at doing that more often. Personalizing things. Nothing is personal. Nothing. So you have to remember that. And once you can sort of detach from the intensity, from whatever they have going on that's personal to them, and you don't own that for yourself, that's huge. So that sort of emotional detachment is really important. But yeah, I mean, there are plenty of people who have BPD, and when they're by themselves, they're fine. Others aren't, because they have a lot of self-harming behaviors going on, or they have a lot of negative thoughts and a spiral going on. But there are plenty of people with BPD who are totally fine when they're by themselves. And that has a lot to do with perspective and interaction and personalizing things, and then getting into that black and white thinking, and then it's a downward spiral. 9 Inch Nails album. Okay. What causes a person to have bipolar and BPD? It's a number of things. So I did video series on the 4 causes of BPD. So you can reference back to that in my feed. And then bipolar is, well, I mean, bipolar and BPD can both run in families. So we can inherit eye color, skin tone, information processing tendencies, whatever. We can also inherit mental health conditions, just like we can inherit cholesterol, propensity for diabetes, whatever. We can also inherit these things. BPD is largely caused by trauma. 70 to 80% is the current estimate of people who have BPD who have trauma. Not 100%, and my videos on the causes of BPD will flesh that out for you. But trauma generally drives that. Bipolar disorder is thought still to be more of a chemical thing. So, I mean, there are things that you can do, like life stressors and stuff can shift the chemicals and send people into manic or depressive episodes. But a lot of the prevailing literature on bipolar is that it's inherited. Whereas BPD, it can be inherited, those tendencies can be inherited, but it's more often related to trauma. So they're kind of different origins for the two different things. Hopefully that helps, Lori. All right, it's telling me I have like 17 messages. I'm sorry, bear with me. Let me get to those. Okay, I just answered Lori. Do people with BPD have problems with always thinking worst case scenarios? Yep. Vicky, they do. It's catastrophization, it's black and white thinking, it's dichotomous thinking, absolutist thinking, whatever you want to call it. It's just very black and white thinking, and then that personalization kicks in, and it's on like Donkey Kong. I mean, it's just everything is catastrophized and maximized and blown out of proportion for some people with BPD. So yes, that's why I do a lot of work on overcoming negative thoughts. I have a $14 Overcoming Negative Automatic Thoughts course right now on the psychoeducationacademy.com. It's linked in my bio as well. So that can help, just kind of learning how to fight off that negative thought spiral. That can help. Found out from my therapist that I might not have bipolar 1, but I have BPD also. I'm very confused. And you know, some of that's not your fault. Like, a lot of therapists don't necessarily pay attention to the distinction. I've done videos about this too. Like, why are people so reluctant to diagnose BPD? For some people, it's ignorance. For other people, they're afraid to tell someone they have BPD like it's some sort of death sentence. It absolutely is not. Y'all know how I feel about that. You have seen me get passionate about, like, stop saying that BS. So some of it is fear, ignorance, a number of different things. But what I would do in this case is I would have the therapist pull out the DSM-5, the latest diagnostic manual for mental health providers, and walk through the criteria with you. Like, look, doc, I'm confused. I really want to understand this. And if I have one or both or neither or whatever, I want to understand it. Can we just walk through the exact criteria? Or you can print them off. You can find them online. Print off the criteria, take them in and say, I want to walk through this. I've written down some examples of why I think I have this one or why I think I have this one or don't have this one or whatever. And take that in and get to the bottom of it. This is your therapist's job, is to help you be unconfused and get to the bottom of that. Do you think IFS therapy works for BPD? If that means internal family systems therapy, I think it can play a role. I do a psychodynamic approach with people, which is similar but different, where we go back and we begin at the beginning and we're unpacking everything that happened to you up until the point you sit in front of me to figure out why you think and feel and behave the way that you do, especially things that happen before the age of 6 when we're in the theta brainwave state. I think it's important to go back and do that digging. That's the short answer to the question. So family systems therapy can definitely help, if that's what you're referring to. About my BPD very confused about my BPD diagnosis. Okay, so unstable. Yeah, I would ask your therapist to walk through those criteria with you. I feel like I'm stuck in time. I have major depressive disorder as well as BPD and other disorders. I feel like I'm in a tornado. It's a lot going on, right? MDD, major depressive disorder, and BPD in isolation, those things are both challenging. So let alone if you have them together. I would strongly recommend a therapist who's skilled in personality disorders and treating BPD. If I can help you with that, certainly reach out. There are resources on my website that you can read. Also, I think the overall, Kay, it's just starting small. Like, pick one thing that you're going to do tomorrow that's different. I'm going to walk to the end of my driveway and back. I'm going to walk around the block. I'm going to take a shower. Like, if you haven't showered, for several days, like, just set one goal for each day. It can when it's all swirling around together in a tornado, that's a great metaphor, it can feel very overwhelming. So the antidote, overwhelm is just another way of saying anxious. So the antidote for anxiety is control. Pick and choose and find ways that you can control something, anything healthy in your life. Obviously, I have to, advise stay away from substances like marijuana and alcohol because they're central nervous system depressants, and those can make depression worse. So just want to be mindful of that. Clean my room today. See, Kay? Bravo. Perfect. That is something. Like, give yourself an atta-girl for that. Kay, that's so good. Unstable, thank you for chiming in and offering support. This is the kind of stuff that we're doing in the community. The subscription group, this is why I'm so excited. Like, I can't wait to see how people are loving on and supporting each other because you're walking through it. Like, I'm the expert. I've been doing this for over 20 years. Like, I can give you skills and techniques and tactics and we can unpack all the things, but it's so cool when there's this sense of universality, like someone else is walking through this with me. And they can, you can share your stories and encourage each other. Question. I have ADHD and BPD, but a psychiatrist told me ADHD can mimic all the BPD. Oh, Alejandra, I don't agree. I know there are plenty of people who feel this way. I've done videos about this. You can go back on my page and see where I did like ADHD versus BPD. The actual symptom criteria in the DSM are completely different for the two disorders, with the exception of like some impulsivity and then how that can cause interpersonal issues, which is, a cardinal symptom in BPD. So at first blush, I don't agree with that. You may have some of both, or you may have fully both, it's hard to say, but I would, again, just like I said for the other viewer, like ask the provider to walk through the criteria with you and like help you get to the bottom of what's going on. So if they're like, well, I think ADHD can mimic BPD, how? Answer that question for me. They're the expert. This is their job. Ask them to help you figure out like what they're talking about. Like, okay, so in BPD, here are the symptoms of BPD from the DSM. This symptom, how does ADHD mimic that? Where do I see this in ADHD? Like, get in there and ask them to help you understand it. All right, I'm going to have to speed up answering because I hear dinner dishes clinking around, so I know what time it is. I have those moments where it takes me days and weeks to clean my bathroom. Yep. I love that y'all are encouraging each other, though. Resistant to therapy, DBT, I'm exhausted and tired of the abuse. Okay, Sunset Lover, I think I may have missed your earlier comment, so I apologize. I don't see it right away. But if you are like a parent or a loved one of someone with DBT, there are some resources available, including therapy for you. But there are books and different things that you can read. Check out the resources tab on my website, drbellingrodt.com, for more information, or message me if you want more information on that. Okay. All right, it's saying 21 new messages. All right, let me try to get through these. And then I'm going to wrap us up. Oh, this moves so fast. Okay. A lot of women with ADHD are misdiagnosed with BPD. Again, I think it's possible, but I think a thorough clinical interview is going to show how those two are very different. So it's just important, whoever your provider is, it's just important to work with them and get to the bottom of that. I had one, but say I had BPD, and one therapist say I absolutely did not. So yeah, you're going to find different opinions across different therapists. I always come back to walk me through the diagnostic criteria, walk me through the 9 symptoms of BPD. Let me tell you what I think is going on for me. Let me give you some examples of those symptoms, and let's do a collaborative effort and get to the bottom of the diagnosis, right? You live in yes, this person on the outside is an expert, but you live in your body. And in your mind. So having them walk through the criteria with you, sometimes that's just the best way to get to it. I'm wondering if my 19-year-old daughter is suffering from untreated ADHD and autism. Yeah, so I've done videos about ADHD, autism, BPD, kind of like ferreting some of that stuff out if you guys want to go back and check those, if that's helpful. Is it true that therapists are scared of BPD, the stigma? It's absolutely true. That's what I was saying earlier. Like, there's ignorance. People don't know enough about BPD to diagnose it. And then there's fear. Some people are just afraid to say you have BPD because they think it's a death sentence. It's not. Yeah, I get really bent about that. But yes, I've done some videos on that too, like therapist fears and how they're either afraid to say it and be the bearer of bad news, or they don't know how to treat it, and so they don't want to acknowledge that that's going on. There's a whole number of reasons why that doesn't get diagnosed the way it should. I was mimicking BPD symptoms because I was living with untreated ADHD. Maybe I'm in denial about my daughter's disorders. I don't know, sunset lover. I think you're here, you're trying to get to the bottom of it. You're obviously trying to help her. It was my 19-year-old daughter who has bipolar disorder and BPD. Okay, still. It like tells me I have messages and then it skips all the way to the bottom. I mean, it's a feed, so that's how it works, right? All right, I think we're about it. Is it real that people with BPD can have problems getting health insurance? You know, it's hard to say. I could see I could see maybe problems getting life insurance. Health insurance, the same way if it's a pre-existing condition, like if they have access to that information and they see that diagnosis on your chart, maybe. I mean, I think there's discrimination across different mental health conditions all throughout the health insurance and life insurance industry. So I wouldn't doubt it. I don't have the data on it, but I wouldn't doubt it. Because they see it as not treatable. Yeah, that's the ignorance that ticks me off. It's highly treatable. In fact, there are some people who say that BPD is one of the most treatable mental health conditions. And I would tend to agree with that because I've been doing this for 2 decades and I've just watched people change their lives. I mean, I see it every day. It's the reason I keep coming back and keep doing this work. It's challenging, this work, right? There's a lot of mental health that I'm carrying around, and it's got to be worth it, right? Any job that you do has got to be worth it. And this is more than a job. This is a career for me. It's a calling. And so, I mean, if people weren't changing and getting better, I wouldn't keep doing it. So therapists are scared to treat people with BPD because of the anger being criticized. The therapists have fear in treating it because of the symptoms, if that's what you're saying. Yeah, I agree. I didn't have a problem. I'm sorry, Tiffany, I'm not sure what that refers to. because they see it as not treatable. Yeah, we talked about that. Okay. I think I'm about at the end. That's encouraging. Good. Is it more encouraging if a person is diagnosed with it earlier in life and starts treatment? Absolutely. I think that's true with anything. Like the sooner, whether we're talking about, okay, I don't decline. Whether we're talking about BPD or colon cancer or like whatever, yeah, I think the earlier you catch it, the better. But it's never too late. I mean, I had a patient with BPD start therapy with me when she was in her 60s. Never too late. Never too late. All right. Yep, here I am. All is well. I'm hopeful because she's only 19. Great, yeah. Jump now and let's get her some. She said because of the emotional dysregulation. Yeah, I mean, I think that gets kind of confabulated with the impulsivity in ADHD, if we're still talking about that. So again, I go back to like, walk me through the criteria and tell me why you think I have this, or tell me how you think these two are the same. Just can't get her to accept treatment and buy into it. It has to, she's going to be doing a constant cost-benefit analysis. We all are. And so when the costs of her behavior outweigh the benefits of behaving the way she does, then she'll get treatment. We get better when that happens. I think that it's a matter of, how it's presented to her, how patterns in her life are highlighted by the therapist, and then she's offered, help for dealing with that. It has to be worth it to her. It has to make sense, right? Any treatment has to make sense. Books, there's a really great book called Get Me Out of Here. It's written by Rachel Ryland, which is actually a pen name. And it's like a patient with BPD recommended that to me many, many years ago, and it is a page turner. It's really good. Get Me Out of Here. And it just describes her journey from being really intense with her BPD to getting better. And so sometimes that can be encouraging. Rejection sensitivity. Yeah, I mean, again, by looking at the straight DSM criteria for ADHD, which is the current standard that we use, I mean, I want somebody to show me where the ADHD criteria talk about rejection sensitivity. Now, if it means like there's a tendency to be impulsive. So if the frontal lobe isn't fully developed, they tend to personalize things, and then they tend to, as a function of that, they tend to feel rejected, and it's this whole impulsive sort of whirlwind, then yeah, I could see that. But that's what I'm saying. I think it's so crucial to just walk through those criteria. The DSM is not perfect, right? But it's the working standard that we have now. And so when it comes to treatment and forming treatment plans, I mean, that's what we have. TMS for BPD, I don't know. The jury is still out for me on TMS. I think it's definitely better than ECT, the electroconvulsive therapy, and it works in some similar ways, is the theory. It also works in some ways similar to EMDR, some believe. I prefer EMDR because you're actively addressing the trauma that way. TMS can be used in that way, I mean, by the right person. Okay, we've detected inactivity. I don't ever understand these because we are actively talking and I'm answering questions, and so in order to not be turned off, okay, so weird. I have to drag this little puzzle piece into a hole. It's so weird. Anyway, so I mean, I don't think it's a bad thing. I've just not seen it be hugely successful for people. And I don't know the data and the research, so that's my ignorance on that. I don't think it's a bad idea. I think you just want to do your research and make sure it's worth the investment of time and money. Okay, where are the... Tells me she doesn't want to live like this, but won't start treatment. Yeah, she hasn't hit her rock bottom. I'm sad to say that, but I mean, I've seen people lose their houses, lose their families to gambling, and keep on gambling. They haven't hit their rock bottom. So it's got to make sense to her. It's got to be worth it to her. And getting her connected with the right therapist, that's going to be really important. Thought EMDR was a joke, but she was also 17 when she tried that. It depends on how it's presented. I give people a lot of data and education before we get started. And I have seen EMDR literally change people's lives. It's one of the best things going, I think, for dealing with trauma. It helps you reprocess it. It's not for everybody. I've had a couple of people who one of them had a brain injury and his eyes just weren't tracking. Another one, she was just overstimulated by the lights, and so it just didn't work for her. So it's not for everyone, but if it's done well and the person can see the benefit and leave the session with, skills for regulating emotions, then it can be really helpful. All right. I am going to head out, you guys. Thank you all for hanging on. Resources for a good BPD therapist. I need a therapist too as a result. Sunset Lover, you can message me and we can start a conversation about that. I see people virtually all over the US. If you want someone local or someone you can see in person, then I can kind of tell you what to look for. So shoot me a message and I will get back to you as soon as I can. BPD, people being in relationships with narcissists, how to handle the emotional confusion, BPD. So I've done some videos on BPD and NPD, narcissistic personality disorder, and a lot of times they end up together because the NPD will be the emotional container for the person with BPD. So you can check out my page for some more information on that. And then if you still have questions, certainly shoot me a message. All right, you guys, I am going to head out. You're welcome, Sunset. BPD, oh, that's AI. Okay. All right. All right, you guys. Thanks for being with me tonight. Get into the subscription group. It's free for the first 7 days. What are you waiting for? Just go check it out. Set a reminder in your phone if you're not sure if you want to stay or not. Then you can make that decision before your card gets charged. So $19.99 a month. First 7 days are free, and I hope to see you guys in the group.